Hello everyone, I am Ritu Sahani, physiotherapist working as a neurorehabilitation specialist certified from AMPT as a neuromanual therapy instructor. Today I am here to discuss about the very important topic, which is the stroke, for the awareness for the stroke, that how we can deal when the patient is having a symptoms, the pre-symptoms before the strokes they are getting the symptoms. So for that it is important to first understand that what is the stroke. It is a just like the blood flow which is restricted, it is not reaching to the brain. So when the brain is not getting the blood proper blood flow, so there will be the stroke. And for the stroke, it can be, the stroke can be the ischemic, where the clot is just traveling through the blood vessels and it's not allowing the full blood flow which is reaching to the brain. And it can be the hemorrhagic, where the clot is burst. The bursting of the clot is the clot is the hemorrhagic stroke. And if there is a clot is traveling and it is not allowing further blood flow, so that is the ischemic. And there one major thing, there is a TIA stroke, that is the transient ischemic attacks. They are the warning strokes, because before the major stroke these attacks are just coming like a warning. It gives us the warning that there is something wrong through your blood flow which is not reaching to the brain, and which is coming with the symptoms like blurring of the vision, the poor balance of the body, and the speech, confusion to speak. And sometimes the patient feel the heaviness in their head, and especially in some area they feel that there is a headache, like the tension type headaches they feel in that condition. And they feel stress also in their mood swings. So these are the things which as a symptoms, pre-symptoms, as a before the warning stroke, these kind of the symptoms come. And there's sometimes we guided by that, the maybe the patient is having a pain related, the problem related to the cervical problem like the vertigo, because the same symptoms we follow in the cervical vertigo also, when the patient is having a poor balance, blurring of the vision, the speech, like the 5Ds which we know about the vertigo, dysphagia, dysarthria, diplopia, and the disturbance, the balance, disbalance. So these are the drop arm attacks. So these are the things like we mismatch with the cervical also. So the first thing, that don't be mismatch these symptoms. And if you are seeing that these kind of the symptoms are coming, where when you see that the patient is having balance is not in the control, their speech, when you are instructing them that like speak some line and they are not able to repeat your words, when you are lifting their arm they are just the arm is coming down like the drop arm sign. So these are the symptoms which is alerting our brain that it is a time to take the medical help, because it is the emergency. So don't miss that crucial period, because if you reach on the time to the hospital when these symptoms are coming, when the stroke is coming, so that time if you reach on the hospital, so that is the first aid, the medical first aid can save you, the damage will be very less. So in this the causes are very common, like the high blood pressure, cholesterol problem, high cholesterol is there, and the patient who are diabetic, the patient who are high BP, and the patient who are having a sedentary lifestyle, they are not doing any exercise, less intake of the water. So they are the people, and the people who are doing regular smoking, so they are the people who are very prone for the stroke. So be alert for these things also. And then when we can see that how the stroke is damaging our body, our functional activity, by if the patient is going through the stroke. So sometime if there is a left brain, they are getting the stroke, so their right body will be affected with their confusion, speech problem. So according to that the symptoms come, and they will be in the confusion. The memory is losses, their vision is very less, taste buds, according to the how much the stroke has affected their body. So according to that, if we are reaching in the crucial, the proper timing before the 4 or 5 hours in the time we are getting the medical treatment, then the loss will be less. And then if there is a left side is there is a problem, so right body and right side is the stroke, then the left body will be affected. And it can be as a hemiplegia, where the same side upper limb and lower limb having the paralysis attack, and if the patient is having a quadriplegia where all the four limbs are affected, or paraplegia where the two limbs are affected. So these are the things which is as a paralysis we see in the patient, the hemiplegic, paraplegic, quadriplegic, and as well as sometimes we see the hemipresis where the weakness of the muscle, that is also known as the hemipresis. So these are the things which after the stroke effect we see in the patient. And we see that the patient, when they are the doctor after the stroke, the doctor prescribe them a physiotherapy. After that the role of physiotherapist comes in this stage, when the patient is discharged to the hospital to they are taking back coming back to their home. So that time their activity, their functional activity, because of the motor deficit, before of the because of the sensory deficit, the patient is not able to lift, they cannot perform, their muscles are having a very, the muscles are having in a low tone, so they cannot do their work properly, their functional activity is restricted. So in this they are in the flaccid stage, just the toe is the hypotonic stage. So when they're just like their limb is like in this condition, so this is the flaccidity stage. So then we see the patient, and their first goal is that how to turning on the bed as a functional, because patient is on the bed, so they, how can they turn on the bed. So that time our rehabilitation play a very very major role. So how we can give them a therapy to train them for their activity, how we can take as a part of the neuromanual therapy, we can treat them. And then after that sit from bed to sitting, taking them to the sitting, that is our second goal. So that also, for that as a neuro rehabilitation we work on that. After that we see that the patient is not able to lift the glass, they cannot take the spoon, they cannot eat the food because of the low tone in the muscles. So muscles are in the flaccidity stage. So there, after our rehabilitation, the muscles are getting the tone, so they are reaching towards the spasticity when their tone is coming back, and after that the synergy come, the same muscles start working. So these are the progression which as a part of the rehabilitation we provide. So this is very very important. And after that the walking from sit to stand, and then walking, how the patient can be do their normal daily activity after the rehabilitation. So this is our role as a physiotherapist. But I will suggest you that first you, if you are as per our awareness as this session, you can see that the symptoms in your family members, if they are high bp, their bp is high, they are diabetic, so please, if they are having this kind of the symptoms, so please just take it as a seriously, don't ignore, don't mix it with any another problem. Just consult to the doctor and check all, do all the medical investigation. And if there is a, these are the starting, the TIA is coming, that is warning you that this is the TIA, so please take it seriously, so that your family member will not be in the worsened position because of the stroke. So now please, I will advise you that do regular exercises, do meditation, so that your brain will work with the meditation, with the with pranayama. And drink more water, plenty of fruits according to your diet, don't smoke. And these are the things, so that you can make your balance, your liver will be in the metabolic activity will be in the right way, and as well as your blood rate will be, the blood flow will be properly, so that there will be no chances of the high bp. If you are taking any medicine for the high bp, take it regularly and do exercise also. So these are the things, after understanding from these points, we can save our family members, we can save our life also, because of these era, the era which is going through, the youngsters are going with the stress. So the stress is also a very major cause to fluctuating their height, the blood rate, their their pulse rate. So this can be the cause for the stroke also. So please be careful about all these things. Live your high life with a healthy lifestyle, so that you can prevent yourself and your family member from the stroke. So thank you so much once again. I am Ritu Sahani. As a physiotherapist, it's my duty to spread this awareness, so that the people who are not able to understand that what is the stroke, they can easily understand, and they can see if any symptoms in anyone, they can just take the medical emergency as a very necessity of our saving our life. So thank you so much, and good luck to all of you.